Dr. Margaret Flowers with Physicians for a National Health Program.
Okay, and where are you and why are you here?
I'm standing on the grounds of the Washington Monument in Washington, D.C. because this week, starting September 20th, which was yesterday, is Health Justice Week. It's the time when we remember the people who have died in this country because they didn't have access to health care, and when we honor those people who are still struggling to get health care.
Okay, what's with all the American flags?
Well, we are using these flags to represent the number of adults in this country who die each year, each year because they don't have health insurance and so they can't get health care. The study shows that about 45,000 adults in America are dying because they don't have health insurance, and that's not the full picture. We know that more people are dying, even those with health insurance are dying of preventable causes. But the significance of this is that the number has doubled since 2006, and just saying that this is really not a tolerable situation, that we have a solution which would end that, and that would be single payer Medicare for all. So each flag represents 10 people, and we're organizing it by state to allow people to see what's actually going on.
So you're at the corner of 15th and Constitution Northwest on the Washington Monument grounds?
That's correct.
And do you need help down here to help you out?
We certainly do need volunteers. We're going to have this exhibit going on all week long. We'll take it down on Sunday the 27th. We need to have people here 24 hours a day to watch the exhibit. And then between the hours of 10 and 6, we have a table, we're collecting petition signatures and handing out flyers. We're having some really great conversations with people who stop by. It's been really interesting, and it's inspired a lot of good conversations. So we do need people to come down if they can help out.
We just met tourists from Israel who said that everybody there is covered. That's the same as most of Western Europe and Canada.
Right.
So you want a single payer system. How come it's not happening here?
Well, primarily because what we're seeing is health insurance reform, because our for-profit health industry has a stranglehold on our political process, and they're the ones that are determining the legislation, and so it's being written to favor them and not to meet the needs of our people.
My name is Mark Dudzik.
Why are you here?
Well, I'm here because it's important to bear witness to the incredible tragedy of all of these lives that have been lost because we're the only industrialized country in the world that doesn't have a humane healthcare system for its people.